Time for our rising crisis update. We'll begin with the number of cases around the world, which as of today have passed 1 million cases, according to the New York Times. 53,259 deaths. Here in the United States, 244,228 cases and 6,257 deaths. Quite a bit of an increase in the death number there from yesterday. And then New York State continues to be the epicenter of the outbreak. 92,770 cases and 2,653 deaths. So deaths continue to worryingly rise in New York and in the United States, with mini outbreaks really in Florida, in New Orleans, in Michigan, and really across the country. Worrisome numbers out of Texas and other places in the American South, where, as we covered yesterday, it seems to be the virus appears to be killing younger people. And of course, there's a problem with rural access to healthcare and healthcare writ large there. So really, it's a troubling situation.
Yeah, and Texas and a lot of the states in the South actually have a higher proportion uninsured, which is also deeply troubling. And as we always say, caveat on these numbers, like the worldwide numbers are based on some faulty information, so always keep this in mind, but it gives you a sense of how things are escalating day to day. At the same time, one of the big resources that was moved into place to help try to alleviate some of the pressure on hospitals in New York in particular, the USNS Comfort, lots of fanfare as that arrived in New York, thinking they were going to really be able to help out. Well, first of all, we learned that they can't take coronavirus patients. Okay. Well, we're in the middle of a pandemic. That's kind of what we thought that maybe you'd help out with, but that's not going to work out. And as a matter of fact, the New York Times is reporting they've only been able to take on 20 patients. Hospital administrators quoted as saying this is a complete joke. I mean, think about the situation in New York right now. You have people literally dying in hallways before they can get access to, the scarce ventilators. You have a city that's running low on body bags. I mean, that is how things are going up there. You've had, general rooms that are converted into crisis centers. You've had the Javits Center, which has been converted. I mean, just a crush of coronavirus patients. And yet this massive, expensive, important facility, this ship, only 20 patients. And on the West Coast, just as bad, 15 patients.
And do you know why? It's bureaucracy. So get this. There are rules that prevent people infected with the coronavirus from coming on board. The Navy is refusing to treat a host of other conditions. Guidelines to get disseminated to hospitals include 49 medical conditions that will exclude a patient from admittance to the ship. And when you call an ambulance cannot take patients directly to the USS Comfort. They have to go to a hospital who will screen them for all of these, conditions that are underlying. Then you can go to the USS Comfort. Does anybody think it's a time for this level of bureaucracy? Put people on the damn ship and let the doctors and the nurses treat them now. It's insane.
I truly do not understand. So we'll keep an eye on that. Good reporting there from the New York Times. Another story following the military here.
Yeah, this is another, the Navy Department is really living up to its charge. So basically there was a commander of the United States ship, Theodore Roosevelt, an aircraft carrier, where the captain of that ship wrote a dire letter saying that several hundred of his crew members have come down with coronavirus, that they are not in a wartime position, they need to be able to dock in order to treat the situation, and that much of the situation on board is simply untenable. That letter was later leaked to, I believe it was a San Francisco-based newspaper. The United States Navy saying at first, look, we're not trying to make anybody a martyr here, nobody's going to get fired. 24 hours later, the Navy Department fires this commander who did his job, sounded the alarm about growing coronavirus on his ship, and now he is, think about this, the first government official in this country to lose his job or face retribution as a result of a crisis that may kill 100,000 to 200,000 people is a Navy captain who warned about growing coronavirus on his ship.
Who is trying to take care of our servicemen and women.
Outrageously disgraceful. And if you want to know what the people aboard the USS Theodore Roosevelt thought about their commander who's just been relieved, we just got footage from the deck of the ship of his sailors chanting his name as he walks off. Let's take a listen to that. that tells you everything you need to know.
Does.
Is that this man is deeply respected by the sailors that he was in charge of protecting. He was looking out and protecting their lives. Everybody I know in the U.S. military is outraged at this situation. And Captain Crozier does not need to be fired. He needs to be promoted to an admiral for what
every
he's
American
done.
should be outraged about this. And the way you put it is so true, that the first official to lose their job is one who was actually trying to protect people, trying to raise the alarm, say, we've got an outbreak here, we got to do something. Our men and women are at risk right now, falling on deaf ears. It gets leaked to the press, and then this is the reaction. Shameful.
Yeah, completely
Absolutely
shameful. And we'll continue to following the story and make sure we track it on whatever updates happen to the captain. And we will have some more rising for you after this.